Hello and welcome to Dakota County's online CSG orientation. My name is Janine Coyen and I am the CSG coordinator for Dakota County. The completion of this orientation is a requirement for anyone to begin the CSG program or Consumer Support Grant. CSG is a program that allows flexible use of PCA dollars. Participants must be eligible for PCA to participate in the CSG program and be on medical assistance. This session will explain how a person can receive funding through the CSG program to purchase services and supports in their home and community. If you'd like to jot some notes down as you go through this orientation, just go ahead and hit pause on the recording and you'll be able to do that. There will be some next steps for you to complete outlined in this training. If you have any questions about those, feel free to contact me. My contact information will be provided at the end of this presentation. Let's begin. In this training, I will be covering the following items. We'll be talking about consumer-directed services overview. It's kind of a philosophy behind all of our consumer-directed services here on Team C. In particular, we'll be talking about the Consumer Support Grant. So what is CSG? We'll talk about that CSG process. How do you get from attending this orientation to being on the program? We'll talk about the CSG plan development. So a plan is required for this program to be written. So we'll go through the steps and what's required with that. One of the forms within that plan is a participation agreement, and we'll review that together as well. And lastly, we'll talk about fiscal management services, FMSs. FMS is a third-party agency in which the CSG funds run through. And at the end, I'll have a few questions, and if I train well, hopefully you'll have the answers. Next, we'll talk about consumer-directed services. Consumer-directed services is the framework that drives all of Dakota County's flexible service options. We have flexible service options for the following programs. Each one of those options have established parameters and guidelines. That's why we have orientation or trainings for each of the program. We have flexible service options for the following programs. For PCA, the flexible service option is Consumer Support Grant, CSG. For our waiver programs, CAC, TBI, elderly, DD waiver, the flexible service option is CDCS, Consumer Directed Community Supports. And lastly, we have the Family Support Grant Program, which is a state grant. Consumer Directed Services is all about choice and shifting the power from the system to the individual. You are the experts. You know the individual the best. We're here to have that partnership with you to come up with a great plan together. So consumer-directed services really enables the managing party and the individual to choose, create, and direct services and supports based on their desires, dreams, and needs. What is it they want? So that gives you a really unique position to be able to do more flexible things. What we really look at, or what the great thing is about consumer directed, instead of really doing like service centered planning, like let's say as an example, you have a young boy who, a young individual that likes to speak about trains a lot. And you're like, you know what, we need to broaden his social skills. So we're gonna go somewhere and do a social skills class. Maybe that child doesn't learn the best in that type of setting. So you can be more creative and do use CSG funds to do more of a person-centered solution or to that. And so that might be, maybe there is a train enthusiast club here in the Twin Cities, and a staff person is going to go with that child to that club, and there it's very appropriate to talk about trains, and they can work on communication skills and conversation skills in an area with a topic that they love and enjoy. So to be able to start CSG, you're going to need some information. You're going to need information about funding and program parameters, which I'll be covering tonight. And then also, if you have a case manager, they certainly can help you with supports and services and resources. We feel here at Dakota County, one of our most important jobs is to give you the information that you need so that you can choose the kind of supports and services that are best going to be for your family and the individual. Next, let's talk a little bit about more specific information about the Consumer Support Grant. As I said before, the Consumer Support Grant is one of our flexible service options within our consumer-directed framework. CSG program is a state alternative to Medicaid home services of home health aid, personal care assistance, and private duty nursing. CSG allows eligible consumers to convert the state portion of payments of a specific home care services into a monthly cash grant. And so how that relates to when you are converting PCA services. So you would have gotten a letter from the MnChoice assessor that tells you, based on the assessment, you're either eligible for 5 hours of PCA a day, or let's say you have a home care rating of T4 and you get $937 a month. It is one or the other, and those are not completely equal. So when you have PCA dollars, that's state and federal dollars. When we convert that to CSG and give you the monthly grant, we only can convert the state portion of the funds. We do not have permission to do the federal portion, so that's why they're not completely equal. But CSG allows you so much more flexibility and options to use those fundings for. CSG is a monthly grant. Like I said, it's based on the PCA assessment or the MnChoice assessment, and it really allows greater flexibility and freedom in that you are going to be able to choose the services, how those are delivered, and the payment rates. Next, we're going to talk about how the CSG grant is determined. The monthly amount of the CSG grant is determined by Minnesota Department of Human Services, DHS. It's based on the activities of daily living dependencies, behavioral challenges, and/or complex health needs documented in the individual's PCA or MnChoice assessment. Based on that PCA home care rating, and those home care ratings will be a letter and a number. So if you receive a home care rating of T4, everyone in the state of Minnesota that has a home care rating of T4 has a CSG monthly grant amount of $937. The individual may elect to convert home care nursing allocations as well. That's based on a nursing assessment for private duty nursing. If that happens to be your circumstances, please contact me directly and I'll walk you through that process, as there is some additional things that need to be completed for that. And also, one thing to think about is if your current CSG grant is less than $259 a month, the family support grant might be a better option for you. So feel free to contact me to discuss that as well. Next, we're going to talk about some eligibility criteria for CSG. To be eligible for CSG, the individual must live in their own or family home, must be on medical assistance, must be eligible to receive home care services from the Medical Assistance Home Care Program, the PCA program, and meet the basic criteria for PCA services. The recipient must have needs in at least 2 of these areas: dressing, eating, grooming, mobility, positioning, toileting, and/or transfers. If the individual only receives has behavioral concerns, they'll receive what is called the LT rating, which is the basic rating. Dakota County reserves the right to assess administrative fee on the CSG program. For the CSG program, that current fee is 5% of the monthly grant amount. When we provide you with what your monthly CSG grant amount is, we always have removed that 5% already. So the number we give you will be the number that you have each month as your budget for the Consumer Support Grant. Now, one thing to know about the Consumer Support Grant is that it is a monthly grant. So that means even though you may be writing a budget or a plan for maybe 5 months, and let's say it's $1,000 a month, so you have $5,000 on your plan, you do not have access to all $5,000 at once. It will come to you $1,000 at a time. So with CSG, it is a monthly grant. So if you want to purchase something that costs $5,010, that first month you only have $1,000, so you would not be able to purchase it. So what will happen then is if whatever you don't spend of that first month of the $1,000, it will roll over to the next month, and then you'll have the $1,000 plus the next month $1,000, so you'll have $2,000. So CSG funds roll over month to month, but they do have an end date. So each one of you will receive information from me regarding how much your monthly grant amount is and what your end date is. Once you come to the end date for your CSG plan, those funds no longer roll over to the next year. Whatever is left unspent at the end of the plan year will go back to the state of Minnesota. Next, we're going to talk a little bit about the CSG process. So how do you get from attending this online orientation to being and receiving this Consumer Support Grant program? So let's walk through the CSG process and your options. So everybody is starting at the top. If we look at this kind of flow chart, so everyone to be able to start CSG must have a MinChoice assessment or a PCA assessment and have medical assistance active or currently eligible for medical assistance. So then after you have that MinChoice assessment, you receive a letter from the assessor stating that either you are eligible for X amount of hours per day of PCA or PCA choice, or you can have a monthly grant of CSG. Now, just because you have attended this orientation, you're not locked into needing to go with CSG. It's simply an information meeting to give you more information so you can make an informed choice. The choice you'll be needing to make here is between, am I going to go with PCA choice, or am I going to do the Consumer Support Grant, CSG? If I decide to go with the Consumer Support Grant, everyone that is interested in that program needs to attend the CSG orientation, either in person or online. And then from there, where you go, if you decide to continue and that's a program that you want to do, is a little bit different. So if you have a case manager or a social worker, you'll contact them, and then I let them know that you've attended or completed this orientation as well. And they may help you with the process of getting a CSG plan written. They'll help with educating, engaging. Once you have completed the CSG plan, you'll submit it to them and they will review it for service planning appropriateness. And then from there, their supervisor will review it. And then finally, it will come to approval with Team C. And I will give the final approval of the plan and get it all set up with the FMS and get all the funding rolling. So that is the structure, the flow that you would go through if you have a case manager. If you do not have a case manager, that means you are what we call an administrative case. And when I send you information about your CSG grant amount, I will write on there, do you have a case manager? Or I'll say you're an admin case. An admin case just means that simply you do not currently have a social worker or a case manager. That may be because you're still in our assessment department and we're waiting to get some testing and make a determination. Or it could be that a determination was made that the individual is not eligible for Rule 185 case management. Either way, you still can go ahead and continue with the CSG grant because you are eligible, the individual is eligible for that. But if you have no case manager, you can still start this program as an admin case. So the participant or the managing party yourself would be responsible for attending the training and submitting their plan, writing it and submitting the plan. All of our admin cases are contracted out and with an agency called A&B Services. So if you're an admin case, we would open up a case to A, B, and B services, and they'll be kind of your contact for the administration of the CSG grant. And then again, once they have looked at the plan and they find it approvable and helped you get it approvable, then they send it to TMC. We do the final approval and set up of the funding. This slide just goes through the process again in a little bit different way because we all learn a little bit and understand it differently. So with the CSG process, before participating in the program, the responsible party or managing party, that is you who is attending this orientation, must attend the orientation. Then you're going to have a PCA or min-choice assessment completed, and then you'll receive an individual budget amount. And I will provide those with you once you notify me that you've completed this online training. Must be on medical assistance, either straight medical assistance or through the TEFRA program. Either one is fine. Then you'll need to select what's called a fiscal management service. So that's a third-party agency that will be administering the funding. That's how you'll have access to the CSG monthly grant amount. Then you'll need to write a plan. So you'll develop a CSG plan identifying needs and disability-related rationale for support, services, and goods to address health and safety concerns, develop skills, promote inclusion, and overall development of the individual. And lastly, once that plan has been approved, then it'll be your responsibility to implement that plan by purchasing and creating supports, goods, and services identified in the plan. So let's talk a little bit about the CSG initial grant process. So you're going to receive an annual budget. And just a reminder that CSG is a month-to-month grant, so you only have access to each month's funding, and then whatever you don't spend rolls over to the next month. So if the item you want to purchase is more than a monthly grant amount, you're going to have to wait and save up for it. Now, the earliest anyone can start this program would be the first of the following month of when you are listening to this orientation. So plans must be completed by the 15th of the month to start the following month. Now, this first initial grant, the length of your plan is going to be less than 12 months, and that's how it should be, because our CSG plans need to match the min-choice assessment, and you had your min-choice assessment probably a few months ago, and then you had to come to the orientation, then you'll write the plan. So when I provide you with your monthly grant amount, I also will provide you with the end date for your CSG plans. So if I have told you either you are in an admin case, administrative case, or you know that you do not have a social worker and you're currently waiting for eligibility determination, you can still access the consumer support grant funding. The cases without case management, we call them admin cases. Dakota County currently contracts with an outside agency called A&B Services to provide support to our admin cases. A&B would be responsible for approving and monitoring plans and approving plan changes. The county's responsibility would be to review the plans, give the final approval, and also do the administrative setup so that the funds would be flowing to your FMS. The managing party, that's you, is responsible for managing funds and submitting plan changes to A&B as needed. The managing party also, you can use or hire a grant support specialist to assist you in writing your CSG plan. Additional information is needed to start if you have no worker. So I have some additional applications. You have to do an application for CSG admin. So when you contact me to let me know that you have completed this orientation, I will get that information out to you as well. So now we're going to talk about the renewal process. So you did that initial CSG plan that was kind of shorter than a year, and then about 3 months before the end date of that plan, you're going to get a reminder email from TMC, or actually I believe believe it's a letter in the mail. Just reminding you that renewal is coming up. So we just kind of want to get you start thinking about it, knowing that someone's going to be calling you probably 2 months before the end date to schedule another assessment for PCA. So just that you're aware to be kind of aware that things will be happening, you'll need to respond. So another PCA assessment must be completed by our contracted public health nurse or a MinChoice assessor. You will be contacted directly by them to schedule the assessment. You don't need to call in and let us know. Only reason you need to call us is if for some reason it's getting very close to when your plan should end and no one has contacted you, then we certainly want to know. But generally they will contact you directly. Then you're going to have to start thinking about developing a new plan. Your plan must be developed and submitted to your case manager or ABNB services the 15th of the last month of your plan. So prior to the 15th of the last month of your plan. Now, if your plan is late and you don't get it in, that always can result in an interruption of your services. And if we really worked with you and tried to contact you and haven't heard from you, it also could result in a loss of CSG funds for a month or until we get a plan in. So it is important to kind of keep opening your mail, looking at it when you get letters from us, to be aware of where you are in the process so that you don't jeopardize your CSG. So next, let's talk about the CSG plan. So what it is, what's included in it. As I've said previously, your CSG plan is due by the 15th of the month, if you're a brand new CSG, to start the first of the following month. So now I'm going to tell you, what does that include? So when I say that your CSG plan is due by the 15th of the month to start the first of the following month, it is these 5 items that make up that CSG plan. I will make sure that you get a link to our TeamC website, which will give you access to these forms online. So let's just talk briefly about each one of these forms, and then I'll go in more depth of the first 2 in the next slides. So the first one is the CDS support plan. This is really a narrative, and where you're telling me about the individual, what their needs are, and then what type of things would be beneficial to them. The CDS expenditure plan is the budget. That's where you're really kind of breaking down the dollar amounts, what you'll be spending and how. And then you'll sign one of our forms, which is called the Consumer Support Grant Participation Agreement. And we will be going through that in more detail in a little bit. You'll sign a release of information consent form for TeamC. This is a release so that TeamC is able to submit the approved CSG plan to the Fiscal Management Service, the FMS, that you are choosing to work with. Without your permission, we are not able to forward that plan on to them. And the last one is acknowledgement of receipt of important information regarding privacy and rights. Really on this form, you're just signing that you received the privacy information. If you have questions about that, feel free to contact myself, or if you have a case manager, and they will answer any questions you may have regarding that. As I said, all of our forms are available electronically on our TeamC website, and we will get that link to you directly once you notify us that you have completed this training. Well, the first form I want to walk through with you a little bit is the support plan. So this is really the narrative. So this gives me the information about the individual, so I understand what the disability rationale is for needs and services. So that first area where it's a client description, what I'm looking for is really just 2 to 3, maybe 4 paragraphs, just really giving me a good overall picture of the individual, who they are, what makes them happy, so I can understand their overall needs. The next question would be, what does the client want to do? Really what I'm looking for there is, what are your goals? So you're going to get the CSG funds this year. What do you hope that will be the result of that? So maybe that is Johnny will sleep through the night, or Johnny will participate in a community activity. What are your goals for that year? And then there'll be another question there that says what progress has been made. And really, with your very first plan here, you're just simply going to write that progress will be noted at renewal. And then when you renew the plan, then you'll tell us, how has Johnny done? What has he improved on? And then you'll notice that we have different categories here. So we have supports, informal and formal, generic services, and goods. So here is whatever you put on your budget. This is where you write the rationale for it. So what is the item, and then how is it disability related? How is this expense not typical parenting or not a typical individual expense, but it is an expense incurred directly related to a person's disability. Okay, so next we're going to take a look at the CSG expenditure plan. So this is the budget. So I want to point out a couple of different areas for you to kind of pay attention to. So at the very top, let's just start there, we have the date span. So the date span will be the first of whatever month that you are starting the program. And then that end date is going to be the end date that I gave you specifically based on your individual's mid-choice assessment. Client is going to be the individual going on the program. Address is the same. County worker, this will either be your case manager. If you don't have a case manager, this will be A, B, and B services. Now the next line is managing party. That is the person who's attending this training. Who is the managing party for the CSG? So that'll be your name, your phone number, and your email address. And then we'll continue to go down the plan. The monthly grant amount, that is the amount that I gave you on regarding how much the monthly grant is for the CSG grant. And then we're going to jump over here to the annual budget. Now the annual budget, you're going to fill that in by looking at your monthly amount and then going up above and looking at your date span. Figure out how many months are in that date span, times it by your monthly CSG amount, and that's your annual budget. This form is, when you use it online, is an Excel document. So you're not, the next one over there where it says budget total for this plan, you're not going to want to write in that cell because there is some formulas behind that that does the math. Then next, going down, continuing down the page, agency funds go through. That is the name of the FMS that you have chosen to work with. So that's examples might be Orion, PICS, MRCI, LifeWorks. Those are FMSs. So that is where you put that line. And then now we're getting down to the budget part. And this is going to match your support plan. So whatever you put on your support plan, then with the rationale you're going to purchase this, now you tell us the dollar amount. So on this it says support staff. You do have to pay support staff at least $13.25 an hour, so you'd have to increase it on this. So that's the unit rate. And then total units, that's how many hours. And then that next column, that percentage, that is the FMS fees. And that is going to be different depending on which FMS you choose. So you will have to get that information directly from the FMS. And then we'll just move to the second page and just look at the very first one. It's kind of blurry on me. For community integration, I think it says, so what community memberships, so then what amount you're going to pay for that, unit 1. And then again, depending on your FMS, there may be a percentage fee for that item as well. So everything that you put on the support plan has to be on the expenditure plan with a dollar amount. If it's on the expenditure plan, it needs to be on the support plan with a disability rationale of why that service or item is needed to help that individual, how it will help them, that information documented. So just to talk a little bit more about the plan development, and in this area, I'm really talking about that support plan. Give some real thought before you begin writing about the big picture for the individual. Life goes by really quickly, and sometimes we don't have time to just really reflect on that person. So describe that person's strengths, needs, likes, and dislikes, and how their life impacts their life. Other things to think about when writing the plan that you want to cover: what will help keep that person healthy and safe? What are the person's long range goals, and what little steps can happen to help them meet those goals? What is needed for that person to be more a part of the community? What will help that person have more control and be able to have more opportunity for choices in their lives? So those are things just overall good to think about while you're developing a plan to see how you can make sure that you've met kind of those needs. Now I'm just going to give you some examples of kind of common expenditures in CSG. Now CSG, sometimes people say, oh, that's a program just for kids. It is not. CSG is for anyone that is eligible for PCA services. So I'm going to kind of go through some examples of different age groups and how they might use the funding to kind of give you an idea of how it might look. So maybe we have an infant who is eligible for PCA services. And so under CSG, they might do some parent pay. They might have support staff or nurses be paid for. And maybe there's some therapeutic items that have been recommended by a therapist that they're going to purchase. So now let's jump up to what might be some common expenditures for a grade school individual on the program. So maybe they're going to do some parent pay and also support staff. Maybe they're going to try some therapeutic horseback riding, and maybe an iPad and a case for communication, and maybe some sensory items that have been recommended. Now then we can look at some adults that might be utilizing the CSG program. So maybe we have adult with some medical needs, some high medical needs. May that be end of life cancer treatment, something like that. So maybe they are going to pay their spouse to provide care for them that's above and beyond what typically spousal care would be. So maybe that's assistance with bathing, assistance with dressing, that sort of thing. Another service that they might utilize is chore services. Maybe they're going to hire someone to come in and help with laundry, cleaning, those type of things that because of their medical needs, they're no longer able to do. Maybe there's some medical items that they need in their home to make it more safe, maybe grab bars or non-slip surfaces, stuff like that. So then also, maybe we have an adult on CSG that has some mental health needs and needs some support in the community. So maybe they're going to use their CSG funds for support staff. Maybe they need some extra support when going in the community to be able to go to the grocery store and run errands. Maybe they would like to take a community ed class, one for socialization, but also to learn a skill. Maybe it's a cooking class or a financial class, whatever might be helpful to them. Maybe they have worked with doctors and individuals that have said some different vitamins and supplements might be helpful for them. And so that would be an example of an expenditure they might have. Maybe they previously drove and now they've had some anxiety about driving and want to get back to driving but aren't sure about it. Maybe they're going to have a driving assessment through Courage Center to help them determine if they're a safe driver still and if that's a good option for them. So as you can see, CSG really can provide benefits from infant to adults. Let's talk a little bit about CSG expenditure parameters. So every item that you request has to meet each one of these parameters to be approved. So the first one is the expenditure must be client driven. So the proposed expenditure must be directly related to the individual's needs and priorities. So the example I like to give about this is I have two plans, one for Susie and one for Johnny, and both of these plans have the YMCA membership on the expenditure plan. But on the support plan, when I look at the rationale, I need to make sure that that rationale would meet this parameter of client driven. So for Johnny, it says Johnny is going to go to the YMCA 3 days a week because when he is able to swim and expel energy at the YMCA, he sleeps better and has less behaviors. Now Susie's rationale for the YMCA is Susie is a high medical child and requires round-the-clock care, and so her mother is going to work out at the YMCA 3 days a week because when she is able to do that, she is better able to care and provide for her daughter's needs. Now, while both of those are good rationales and reasons for going to the Y, we would only be able to pay for Johnny because that is about Johnny going to the YMCA and having benefit. With Susie's plan, while it's great that mom would be able to go to the YMCA and work out, and I think that's a great idea, that's not something that CSG can pay for because it's directly related to mom's needs and not Susie's. So the other parameter that we look at with each expenditure is health and safety. The proposed expenditure must support the individual's health, safety, and general well-being. Is the expenditure fiscally responsible? So the expenditure cannot be covered by any other source. So if it's something that can be paid directly by medical assistance or private insurance, those sources have to be exhausted first before you can utilize CSG funds. And lastly, the expenditure must be defensible use of taxpayers' dollars. And really, you are the one that provides that defensible use in your rationale by giving us the information to tell us why is this not a typical expense. This is an expense that is above and beyond and directly related to the individual's disability. Now you will find on the TMC website that we do have an expenditure guide for the CSG program. And I want to emphasize that that is a guide. It's not a rule book. Just because something isn't listed in there as something that you can use CSG funds for doesn't mean that it's not, that you couldn't. It simply means we haven't been asked about it or hadn't thought about it. So the guide will be available on our TMC website, which we'll give you a link to at the end. It's developed by Dakota County and is established parameters for expenditures within our program. If you have a question about, hey, can something be covered, go to the guide first. If you don't find it in the guide, then feel free to email your case manager or Team C. The guide can be found on our Team C website. And I'm going to just cover a few things that are in the guide that are really common expenditures that I just kind of want to highlight. So I'm going to give you some more information about community activities, parent or spousal pay of staff, as staff. We're going to talk about support staff, so those are other people that might be helping out, and then iPad and tablets, because those are very common expenditures, so I'll give you more details regarding those specifically. So let's talk a little bit about the expenditure of community activities. So community activities are typically family or personal responsibility, unless there is an expense related to disability that's above and beyond a typical family expense. So one example of this is maybe your family goes to the zoo or goes somewhere in the community. Now that's a typical family expense. Families do that and their parental responsibility. But maybe the individual has a hard time with sound and needs noise canceling headphones. So those would be covered as a related expense related to disability. Now here at Dakota County, we really strongly emphasize and recognize that integration of persons with disabilities in the community is very important. And we want families to be taking especially children in the community so they learn to get community skills. And so we will make sure that you have a couple of specific places that you can work on those skills. It will require a formal goal, must be described in the support plan that outlines the goals. So what are you going to be working on specifically in the community, training, and frequency of activity. Now that frequency of activity is very important because that helps me to differentiate between what is a family activity and what is a skill building activity, because they are very different. Now with a skill building activity, you go back to the same place over like at least weekly, and you work on a specific goal. And a family activity to me would be, oh, we're going to go to Disney on Ice. That happens once a year, so that's not really something that you're going to have a formal goal with. It's just something the family does. So to be able to have a activity paid through CSG, there must be a formal goal, talk about the training, and the frequency of activity. So it must be happening at least weekly to continue to work on those skills. Community activities that are adaptive, such as Special Olympics, Project Explore, are fundable. And then we come to enrichment classes, and those are always kind of difficult because they are considered parental responsibility. Karate lessons, swimming lessons, pottery, those type of things. But we may approve those with a therapist recommendation and identification of a disability-related goal. So if your child is working specifically with a therapist and the therapist has said, I really want you to take this class because you're going to work on this goal, we would consider that approvable. Enrichment classes for adults are fundable with a specific goal and skill development identified. With adults, we do not require a therapist recommendation. We just do with enrichment classes for children. Next, we're going to talk about paid parents of minors and spouses staff. As I go through these different rights and how it works, it pertains to both paid parents and spouse, but I will be just in the narrative talking about paid parent, but it does also pertain to spouses as staff as well. So paid parents of a minor continues to be a controversial issue. Every parent of a minor does not have a right to be paid. Parents of minors have a right to be paid if all of the following apply, and that also is the same for paid spouses. So if the individual needs staff to perform services for or with them, that there is a list of tasks that staff will perform, which is a job description. So what are you doing that's above and beyond as a parent for a child that age? The parent is able to perform the duties in the job description that are above and beyond what is considered parental responsibility. So one of the things that come in play in this part is that if the parent is not doing the job duties, so let's say the child, part of the job duties is to make sure the child is ready for school in the morning, assistance with getting breakfast, getting dressed, bathing, those type of things. If that child shows up at school and those tasks have not been done and a report is made to the county, then that parent is no longer eligible for paid parent because they are not doing their job duties. They have to do the job duties. Also, the parent must be able to be hired as staff and pass a criminal background check. So that must mean the parent must be eligible to work in the United States, be able to pass the criminal background check, which does also require a fingerprinting. Paid parent of a minor can only be paid for time spent doing tasks that are above and beyond what typically would be completed by a parent of a child that age and are directly related to the person's disability. So in the support plan, to be able to get parent pay approved, you need to, and this also pertains to spouses, staff as well. These 3 items must be outlined in the support plan. There must be a statement stating that parent will be paid for care provided that is above and beyond typical care. In this example, I'm saying a 10-year-old child. So that's where we're doing defensible use of taxpayers' dollars. We're not paying parents for being a parent. We're paying them for providing care that's above and beyond typical care required. It's directly related to disability. And then next, you need to list what are those tasks that you do that are above and beyond typical parenting. You can start in your morning and just walk through what you do and how you help that individual that is not typical for their age. So in this example, we said complete assistance with all activities of daily living. You can go ahead and list those: toileting, toothbrushing, eating, whatever that is, multiple diaper changes, and constant supervision to ensure health and safety. So for a 10-year-old, those are definitely things that are above and beyond typical parenting. Now, if this was a 2-year-old, we would say, nope, those are parenting items. So just understand that it's tasks that are above and beyond typical required. And then typical schedule. As a parent, when are you typically going to be doing these parent hours? So we have your job description, that's the task. Now we need your work schedule. So based on the budget, this individual is able to have 8 hours a week, and the parent is going to be working those hours Monday through Friday between 6 and 8 p.m. A little more information about paid parent of minors and spouses. They are never called PCAs. PCA was that other program that you didn't choose. That was the hours per day. Under the CSG program, it's either called paid parents of minors or spouses, paid spouse. They're always being paid as staff, and that is a 1-to-1 ratio unless otherwise stated. So the parent is working one-on-one with the individual. The rate of pay, including all employee taxes, cannot exceed the current PCA rate, which is currently $17.80. So the rate of pay plus the employer taxes cannot exceed that. So depending on which FMS you work with, the highest amount that a paid parent or spouse can be paid is different. It generally runs around $16.95, somewhere around there, but you need to check directly with the FMS. Now, regarding parents, in combination of all parents, step and biological, regardless of the number of the children in the household that are currently on a consumer-directed program, they cannot be paid more than 40 hours per week. We do not do overtime. Also, if you happen to have more than one child that is on a consumer-directed program and you're being paid as a parent, there is an additional form called a parent pay addendum that you have to complete. It is required to ensure that there's no overlap in hours, because If you have 2 children, if you work from 1 to 2 o'clock with Susie, you have to work from 2 to 3 with Johnny, because you cannot double bill medical assistants, so the hours cannot overlap. Spouses as well, we ask you to limit yourself to no more than 40 hours a week. And one thing to know about if you're taking CSG funds as paid parent or as a spouse, that when CSG overall, the monthly grant amount is not taxable income, but whatever you put in a line item for paid parent or paid spouse is taxable income. It's just like you got a job at Starbucks or anywhere else, and that could affect any income-based programs you are on. So if you're on Section 8 housing, food assistance, medical assistance, this is taxable income. It is a job, so it could affect your benefits for those programs. So I just want to make sure that you are aware of that. So support staff are the other people that you would hire to provide support to the individual. So this could be grandma, this could be an aunt, this could be a sibling, a neighbor. So with support staff, the hourly wage must match the needs of the individual. Typical pay is generally going to be between $13.25 and $16 an hour. That's based on the expertise and the client's needs for that expertise. So certainly if you have an individual that needs special expertise for staff to work with them, then definitely you could pay more than $16 an hour. You just have to justify that in the support plan. Due to the labor law agreement between Service Employees International Union and the state of Minnesota, the minimum wage for all staff, be it parent or support staff, on CSG is $13.25 an hour. No one can be paid less than $13.25 an hour. Support staff are never called PCA. PCA is that other program that you didn't choose. When on CSG, all staff are called support staff, and they are paid as staff, and that is definitely a 1-to-1 ratio. So if mom and dad are going out and there's 3 kids at home, the child who is on CSG, the support staff can provide support and supervision to them and be paid. But for the other 2 children, if they require supervision, another babysitter would have to come in and be paid out of the parents' funds to watch them. Again, we limit our support staff to no more than 40 hours per week, as we don't pay overtime. And then just a reminder to make sure that you do not allow your staff to work before they've been cleared with the FMS, your fiscal management services. So they must be cleared as far as their fingerprint and their criminal background check before they start working. So let's talk a little bit about that labor law agreement that is between SEIU and the state of Minnesota. So all direct care employees, support staff, and parent pay are covered under this new labor law agreement. The requirements of this labor law agreement include some of the following items which must be written into the CSG plan. The first provision is the labor law agreement has a provision for paid time off for all direct care staff. That includes paid parent and support staff. Staff will earn 1 hour of PTO for every 43 hours worked. Staff may use their PTO after working 600 hours. The cost of PTO must be built into the CSG plan, and the current rate for that is 3.1%. The next provision of this labor law agreement is that staff will receive time and a half when worked on the following 5 holidays. There is no additional funds that are provided for this increase in pay. It's simply that in your budget, instead of using 1 hour of support when people work on these holidays, you would use 1.5 hours of support. The 5 holidays in which time and a half is required is Labor Day, Thanksgiving Day, New Year's Day, Martin Luther King Day, and Memorial Day. If no one works on these holidays, then there is no need for time and a half. It's only if staff actually work. Minimum wage for all staff must be at least $13.25. It continues that all direct care staff must be enrolled with DHS and receive a 10-digit UMPNI number before they can be employed. The FMS will help you with compliance and assist you through this process. And also, currently, all direct care staff are requiring criminal background checks and fingerprinting at this time. If you have any questions or concerns regarding the union information that I covered, please contact the SEIU Healthcare Minnesota directly. You'll see on this slide, we have the member hotline, the member action center, as well as their email address. The next common expenditure we're going to talk about is computers and electronic tablets. For computers, we fund those up to $1,200. That includes any additional equipment such as a printer. Electronic tablets, that's your iPads and Kindle Fire. We approve cost-effective amount fundable up to $700. Now, sometimes you might have a speech program or something like ProLoQ, which may require a larger hard drive or a larger space on the electronic tablet to run. If that is the case, please just document that in your support plan and let us know, and then we would approve beyond the $700 for a disability need. Now remember, plan wisely because it's either one or the other. You can either have a computer or electronic tablet once every 3 years, but not both. If you find that you would like some assistance with plan development, that you have a few options. You can hire a support planner or support broker to help you develop your CSG plan. They generally charge between $40 and $60 an hour. Again, you can write your own CSG plan. You're the expert, you know the individual the best, and you can write your own plan. The last option you have, if you've gone through this training and you've decided that maybe this is not the best option for you, you can always elect to continue or start on straight PCA services instead. I just want to review with you a couple of CSG reminders to keep in the back of your head. First one is if the individual is hospitalized or placed outside of the home, CSG funds, including paid parent and paying staff, cannot be used during hospitalization or placement of the recipient outside the home. With hospitalizations, the reason it cannot be used, even though you may be sleeping overnight in the hospital room with your child, a parent cannot be paid because medical assistance is currently paying the hospital. So we can't use CSG, which is medical assistance dollars, because that would be double billing medical assistance, which is against the law. So just remember, during hospitalizations, you cannot utilize CSG at all. If you just go in the emergency room and you discharge that same day, that does not count. These are hospitalizations where you stay overnight. Another reminder is that CSG is a monthly grant, so you cannot spend each month more than what your grant is. It's your responsibility as managing party to review the expense summaries from your FMS to ensure that you do not spend ahead. And then the last reminder is just that all staff must be paid at least $13.25, as that is the minimum wage as dictated by the union law labor agreement. As I said before, if you would like some assistance in writing your CSG plan, you certainly can go ahead and hire a support planner or support broker services. To be able to locate those support planners, I would refer you to minnesotahelp.info. In the search bar, just type in support planner and it will return the topic of support broker services, and that'll give you a complete list of support planners that you could hire to assist you in the development of your CSG plan. Let's talk a little bit about amending the CSG plan. The approved CSG plan is considered the plan in effect unless and until any proposed changes are submitted to the assigned worker and approved. Clients are expected, except in extenuating circumstances, to limit their plan changes to no more than once per calendar quarter, and that's simply because of staff availability to process those changes. The other thing I would remind you is that CSG plan really is a living document. It's not something that you write at the beginning of the year and you're going to throw in a drawer and not look at again. So the best thing is to look at it, at least quarterly, maybe even monthly, And if you find there's something that you had on the plan that didn't work out, or you're not going to be utilizing, or have changed your mind, it's a good time then to go ahead and request that plan change to move those funds that you're not going to use to another area that you will be using. The earlier you make those changes, the better. We do request that you refrain from making changes in the last month of the plan, because we may not be able to approve them just because of staff availability. No changes can be approved after the plan year is completed. So amending the plan. To be able to move funds from line to line or make any changes on the plan, you must submit a plan change form or email request. The times that you would do this is when you're requesting a change to the existing plan, you're adding or substituting a service on the plan, substituting a service for $500 or more, or your budget amount changes. You should submit your plan changes to your assigned worker or AB&B if you are an admin case. And then please make sure that you get approval before you move forward with those changes. As with all of our services, if there is a reduction in service level or termination of service, the appeal process is the same as any other program of services with Dakota County. If there is a denial of a particular expenditure request by the Dakota County worker, the supervisor, or the CSG coordinator, you may ask that that request be reviewed. If the request is denied, the appeal process is the same as any other program, and you'd be able to appeal that decision. Next, we're going to review one of the forms that is part of the CSG plan. It's called the participation agreement. I just want to take time to review this with you because there's a couple of sentences or areas that I would just like to give a little more clarification. By signing this participation agreement, you understand that you have the authority to spend and direct the fund budgeted by Dakota County for the above named individual as you see fit, as long as the expenditures follow the approved CDS plan and CDS policy established by Dakota County and the Minnesota Department of Human Services as applicable. Dakota County has responsibility for determining the appropriateness of participation in CDS and sole discretion regarding methods of distribution of funds. I would like to clarify that last sentence to just explain that what that means is Dakota County has the right to determine your appropriateness to be on CSG. So if you struggle with following the plan, following the rules of the program, it is at our discretion, Dakota County's, if you remain appropriate or not to be on CSG. The entitlement service would be PCA. So you will always have PCA services no matter what, but being on the CSG and having the flexible use of the PCA dollars is at the discretion of Dakota County. By signing this participation agreement, you understand that you are responsible for preparing the CDS plan, and you may include whomever you choose to prepare your plan. Your Dakota County assigned worker and/or their supervisor must review and approve the plan before any distribution of services can occur. If there is a denial of a particular expenditure request, you may ask that the deputy director review the request. If the deputy director denies the request, you have the right to appeal this action taken, and at that point you would go through the appeal process and appeal to the state of Minnesota. By signing this, you also understand that your approved CDS plan will be considered the plan in effect unless and until you discuss changes with your Dakota County assigned worker and the requested changes are approved by them. By signing this participation agreement, you understand that you are responsible for deciding who will arrange for supports and services identified in the plan. You assume full responsibility for your choices of persons to provide unlicensed support. Understand they are not Dakota County employees, and you will not hold Dakota County responsible for any act or omission on the part of these persons in provision of that support. By signing, you understand that the persons you select to provide support are mandated reporters of suspected abuse and neglect. As such, by law, they are required to report incidents of suspected abuse and neglect of the above named individual. By signing this participation agreement, you understand that the amount of funds budgeted for the plan year of the above named individual is a sum total of funds available for that plan year. No additional funds are available. If an emergency arises, you can request additional funds under regular county procedure guidelines. In the next couple of slides, we'll be discussing kind of giving a fraud warning and also giving some examples of what might be misuse of funds. So CSG funds are the state portions of medical assistance dollars. The state has asked Dakota County to remind people who participate that fraudulent use of funds can lead to state investigations and the ability to remain on consumer-directed services in the future. One-to-one staffing is always required unless documented and approved on the plan. And Dakota County has the responsibility for determining the appropriateness of participation in CDS and sole discretion regarding methods of accessing of funds, which means that PCA services is the entitlement. Being able to participate in the CSG program and have the flexible use of those PCA dollars is at the discretion of Dakota County. So let's talk about some examples of misuse of funds. So one would be not spending budgeted to provide services needed. So maybe when the plan was reviewed, the person who reviewed the plan said, you know what, you have to get a fence. It's really a health and safety thing. That's going to be our #1 priority that we say you need to do. If then you choose not to and you move that money to parent pay or something else, we would consider that as misuse. Overspending CSG, because it's a monthly grant, if you spend more than your monthly amount in that first month, then actually you are committing fraud because you are spending funds that you don't have yet. So that would be misuse of funds. Inaccurate, incomplete, or untrue time cards. If an individual is hospitalized and you submit time cards during that time, that would be misuse of funds because it would be double billing of medical assistance. Unapproved overtime. And then I just like to this is a misuse of funds, but I like to give people a warning about how to handle time cards. So when you have time cards, it is fine to have the paper time cards out there for your staff to go ahead and fill out and put the time that they work on there. But once they have completed a time card, they need to turn that into you as managing party. And at that point, you do not return that completed time card to your staff person at any time. Because if you did return it to them and they made any type of change on it that you were unaware of, and then that was found to be fraudulent, the person that they come back to as far as who's responsible is the managing party that signed that plan. So how you need to handle time cards is your staff will fill them out. When the time card is filled, they will give it to you. And once that time card is in your possession, you are the one that submits it to the FMS and you do not return it back to staff at all. Now, one of the last things we'll be discussing together is fiscal management services. Remember, I spoke about those early on. They are the third-party agency in which you will have access to the CSG funds. So the only way you have access to the CSG funds is through the fiscal management service. As I said, fiscal management services are the agencies that disperse the grant funds on your behalf in accordance with the approved CSG plan. Now you must have an FMS decided. There's, I believe, 12 or 13 in the state of Minnesota. You can choose to work with anyone you'd like. And you'll need to choose one before you develop your plan because they each have different fee amounts. And so you'll need to know what those fees are when you're writing your expenditure plan. You can find a list of the FMS providers and specific information about each of their rates at this DHS website. And once you notify me that you have attended this orientation online, I will send you an email that has all these links on them as well. So what does an FMS do for you? Well, they're going to assist you in hiring, paying staff, including parents. So they're going to process time cards. They're going to do everything you need to do to get your staff hired, be that the criminal background check, the fingerprinting, the unique provider number from DHS. They're going to help you with all of that. And so they will process time cards for staff to get paid once they've been hired. They're going to reimburse you for non-payroll expenses when a receipt or bill or other appropriate documentation is submitted. So maybe you have diaper wipes on your plan and you're going to submit the receipt without what other documentation that FMS might require for wipes, and then they will reimburse you for that expenditure. They maintain all your records and track all your expenditures, so they know how much you have remaining in each category and where you are as far as your spending, and they will provide you with a monthly summary of your expenditures. It's very important that as managing party, you are responsible to monitor that and make sure that you haven't spent ahead and that you're in your current month of funding. So please make sure that you take a look at those monthly summaries from your FMS each month. Following the approval of the CSG plan, the only way you'll have access to the CSG funds is through the FMS, or the fiscal, also called the Fiscal Management Service. You will choose one of the FMSs within the state of Minnesota, but you can choose to work with whichever one you would like. Approved support services and goods will be paid by the FMS on the client's behalf. Fees for that FMS's services are part of the individual CSG budget and will come out of the monthly grant amount. Next, we're going to talk a little bit about exiting the CSG program. So sometimes people are going to want to terminate their participation in CSG because they're going on to another program, probably a waiver. So clients, you may terminate your participation in CSG program by notifying your Dakota County assigned worker. Transition time for services and changes of funding may be needed, and it's going to really be on a case-by-case situation. Now, remember where I talked a while back about with CSG, it's a monthly grant and you can't spend ahead. Now, the worst thing that can happen is when a family comes to us and says, you know what, I'm in an emergency, CSG is not currently meeting my needs, and I would like a waiver. If you have spent ahead in CSG, even though you're in a crisis, we're not able to move you to the waiver because you've spent ahead. So that's why it's always very important that you stay within your current month of CSG funding. And because CSG is a monthly grant, we do have participation end at the last day of the month if that is possible. Sometimes that is not possible with the transition to a waiver. But just the biggest thing is to remember, stay within your current month of planning. Know that we can change programs, but sometimes it takes some nuances depending on where your spending is. So let's review some questions and answers together. These are just some things that out of the training I think are really important, and I just want to make sure that you have a good grasp of these concepts. So what happens if you budget for a larger dollar item that's more than your monthly grant? So you want to get a computer or a fence and it costs more than what your monthly amount is. Because CSG is a monthly grant, you need to budget accordingly, and you're going to have to save up for the reimbursements cannot exceed the total currently available. So with CSG, you cannot pre-spend. So CSG funds roll over month to month, but not year to year. So anything you don't spend 1 month rolls over to the next month until you come to your end date. The next question is, do you have to have an FMS? Yep. Everyone that participates in CSG has to have an FMS because that is the only way you have access to any of the funding is through that FMS provider. Our next question is, if a parent is paid a staff, I know I cannot exceed the total of $17.80 an hour, but what about my other support staff that work with my children or my child? Is there an hourly maximum? Now, as we said, the average range for staff payment is $13.25 to $16 an hour. That's based on the expertise they're able to provide and the client's need for that expertise. Now, certainly, if you have an individual that requires staff with a much higher level of expertise, you can pay more than $16 an hour, but the CSG plan should include justification of the need and the expertise for that hourly wage. What if your plan is late? Well, unfortunately, this can result in interruption of services. You could even lose a month of CSG funds if the plan is not submitted by the 15th of the month prior to the end of the plan. As always, make sure you communicate with your worker in these circumstances so that they can work with you and help you coordinate. Now that you've completed the CSG orientation, here are your next steps to complete. Please send an email to teamcsocserve@co.dakota.mn.us to notify us of your completion of this training. In that email, please make sure you include the following information: your name as the person who has completed the training, your phone number, your email address, the name of the person that will be going on the CSG program, the name of that person's case manager if they have one, and also include the date of that you completed the online CSG training. Once Team C receives this information, we will send you an email back with the needed links from this training, CSG information specific to the individual that you attended orientation for, and will outline your next steps to be able to get on and start writing a CSG plan.